Hello, I'm Dr. David Smith. Welcome to Smith Plastic Surgery here in Edina, Minnesota. Plastic surgery only is what we do here. I've been here in the Southdale Medical Building practicing since May of 1985. I've put this video together to help folks that are considering cosmetic plastic surgery. You need to know the sort of qualifications that a real plastic surgeon has versus a cosmetic surgeon that may or may not have any training whatsoever. There's a lot of these certificates. I'll go through them really fast to summarize this so that you know what to look for and what they mean. So I graduated undergraduate and also MD degree from the University of Minnesota. My degree at the University of Minnesota was awarded with Alpha Omega Alpha, which is like the Phi Beta Kappa of medicine, meaning you're in the top 10 or 15%. I went on to do 6 years of surgical training, ending up at the University of Wisconsin at Madison. I finished there, and I passed my boards in surgery, showing I'm a board certified general surgeon. I went on to study plastic surgery at the University of Tennessee and finished there, and I took my boards in plastic surgery right here, and that means I'm a board certified plastic surgeon, which is the most important thing of all. And we do have an accreditation for our surgical facility in here that we've had since 1990. The AASF, which is the absolute gold standard of accreditation for surgeons performing cosmetic surgery in the office. That means essentially we meet the kind of standards that a hospital operating room requires. Continuing on with a tour of our office. This is Andrea, our patient coordinator, very capable. She's the one that helps coordinate surgery for our patients and pre and post-op visits. We have our plastic surgery office operating room. This has got the full accreditation. There's probably about 7 of these in the state of Minnesota, and that means that we have very special equipment. This is our anesthesia machine, our operating table. Over here we have our liposuction equipment and cautery, and all of our instruments. On surgery days, which is approximately once a week, we have a team of 3 from the hospital OR come in to help us. I have a certified nurse anesthetist I've worked with for years. We use general anesthesia here, almost exclusively. We use general anesthesia because the patient is completely comfortable, and also general anesthesia lets me do the full and complete surgery for greater efficacy. Local anesthesia, you kind of have to often quit when you've got sort of a good result, but there is compromise there, and certainly the patient would be less comfortable. We also have a registered nurse that I've worked with for 20-25 years. She supervises the care of the patient in the recovery room and helps out here in the OR. And I also have a certified surgical tech that scrubs with me. This is a very busy practice here. Typically we'll do about 6 patients commonly on a surgery day for the shorter cases, or 3 patients for the longer cases like tummy tucks. And we're able to fully take care of them here. And I think we can do better surgery than if I take them to the hospital OR, because there I can't choose the instruments and the nurses to help me. Here we've got everything totally optimized, and again, it meets the highest standards. This is our wake-up recovery room. Our patients are here for an hour or 2 after their surgery to finish waking up. They are here with a friend or family member as they finish waking. They're fully monitored. So this is our consultation room. We meet with patients before surgery. We're also set up here to do minor small cases, little touch-ups. Now we come to the final part of the video where I give you my best personal recommendations to choose a cosmetic plastic surgeon. and you need to be prepared to ask these questions. When you're talking to an individual, find out if they're really a surgeon with real surgical training. They might be a family practice doctor working out of their specialty. Maybe they bought a liposuction machine in Miami or Las Vegas and took a weekend course. Believe it or not, that happens frequently in this state. You need to ask them, do you have a busy clinic? Do you do lots of cosmetic plastic surgery? Do you do only cosmetic plastic surgery? Do you spend most of your time doing reconstructive plastic surgery? It's very difficult to do everything in plastic surgery and do it well. For at least 10 years, we've limited our practice solely to cosmetic plastic surgery. Do you have surgery privileges in a hospital to admit patients? Is it real surgery privileges there? You can do surgery, or is it just admitting privileges and then the patient is treated by somebody else? If you have an operating room in your office, is it an accredited operating room or simply a room in a doctor's office? You need to ask yourself, does the consultation with the provider give you a lot of information? Do you feel comfortable with that doctor? Do you feel that they're competent? Do you like the doctor you're talking to? When you go on the website, are the before and after photos of the surgery absolutely gorgeous, and are there lots of photos there to demonstrate that it's a frequently done surgery? And then lastly, ask about cost. A really well-managed plastic surgery office with in-office surgery can be very cost competitive. I think that's an important consideration if it were for myself or a family member, and I would definitely consider that to be important. Here, I'm very lucky to be in a specialty where regularly on a weekly basis we help patients improve their lives in a significant manner, and it's a privilege to do what we do here. So I hope these comments may be a little long, but I hope you'll use them to help find yourself a good cosmetic plastic surgeon and look hard at us. Thank you.